A pleasant day and a warm welcome to your favorite show, iMed. So iMed is a program where we discuss certain health-related issues, giving you advices to lead a successful, disease-free life and even maintaining a proper well-being. The mental, physical, social and spiritual well-being is the utmost importance in maintaining a proper lifestyle. So adhering to those circumstances, we give you advices with certain guests which have certain numerous disciplines, examples, hands-on skills on those related issues. So today also we are going to discuss one of the most important areas. So when it comes to the thyroid related disorders, simply we have many endocrine related disorders. So endocrinology, basically we concentrate about diabetes, and when diabetes condition is concentrated, we discussed a previous program, and the second most important endocrine disease will be thyroid related issues. So to do the honors with us, we invited Dr. Manilka Sumanathilaka, consultant endocrinologist of the National Hospital of Sri Lanka and the president of the Diabetes Association of Sri Lanka as well. So thank you very much, sir, for joining with us with today's discussion, and we are going to start off with thyroid related disorders. So can you explain simply what thyroid related disorders are?
Yes, as you said correctly, it's the second most common endocrine disorder that we encounter in the population, and it's increasingly being recognized now.
Right.
It is there, it was there before because of the frequent testing and availability of testing. More and more conditions are being recognized. So broadly, as you know, thyroid is a small butterfly shaped gland in front of your neck, and it produces a hormone called thyroxine, which is essential for life, more to say. It involves in your metabolism, it maintains your temperature, it's needed for almost all the functions of the body, including your brain, proper functioning. So broadly there are three categories that I can think of when you say thyroid disorders. It's the underactivity of the gland,
Right.
the condition associated with underactivity of the gland, which is not producing enough thyroxine hormone to maintain the body. So that is called hypothyroidism. Then there is the other end, where the gland has become overactive and produces too much unwanted amount of thyroid hormones, which is called as thyrotoxicosis or hyperthyroidism. And then there is a third category where the gland is enlarged,
Right.
and there may be even nodules which appear in the gland, which is called a goiter, which can be sort of a benign or innocent one, or sometimes, very rarely, it can be turns out to be a malignant goiter. So these are the very broad categories of thyroid problems that I can think of.
Yes. So giving a start off with the underactive thing, the hyperthyroidism, as you mentioned. Can you just, yes, hypothyroidism. Can you just explain it, sir?
Yes. So the body needs a certain amount of thyroid hormones, and for whatever the reason, there may be many reasons, out of which what we call as chronic autoimmune thyroiditis is the commonest cause of hypothyroidism in our country at the moment, but certain countries it will be the iodine deficiency. Whatever the reason, the gland is not producing enough thyroxine to maintain the body physiology. So when that happens, there are certain symptoms that will appear. Patients feel lethargic, they get aches and pains, muscle pain, then they feel sleepy during the day. Then as it progresses, there may be dry skin, hair loss, they tend to gain weight, and they might feel sleepy during the day. That's another common presentation that they have. And cold intolerance, that means they feel cold in unusual situations. When it is relatively warmer, when others are not feeling it, people feel cold, or they in a cold environment they find it difficult to cope up, like in a air conditioned environment. So these are the common symptoms of underactive thyroid or hypothyroidism.
So shall we move on to the overactive condition as well, discussing about the symptoms and those specific areas?
So it would be the opposite of that. The gland is overactive, lots of hormones are coming in, so you tend to be agitate, the mentality, the hypothyroidism, you slow down basically. Your memory goes down, you are lethargic, slows down. It's the opposite of that. When it's overactive, you tend to be overactive. There will be tremors, your fingers, and especially in the fingers it appears, there will be little tremors that when you want to do any fine job, it will be difficult sometimes, even writing. And then you will be sweating a lot, profuse sweating. Unintentional weight loss is another common presentation, and of course you feel warm all the time, the opposite of what I said before. And opposite of constipation, they need to pass stools more frequently, or even loose stools when the condition is severe. And your heart will be beating very fast. Some people say they'll feel their own heartbeat, what we call as palpitations. So these are the common presentations that we see with the overactive or hyperthyroidism.
Right. So sometimes we see some patients and people with an enlarged gland in the neck. So let's move on to that topic.
Okay, so you say enlarged thyroid is called a goiter, technically. So the thyroid gland can be enlarged when the patient is having either underactive gland or overactive gland, or without any problem with the activity, it can be just enlarged, and it can be benign or malignant. So these are the broad categories. And so when they have an enlargement, there could be many things. Looking at the activity, we can treat under or overactivity. If it is not producing any problem with the hormone levels, we need to look at the goiter, whether that is causing any problems with your, the structures around the neck. What are the common structures behind it? That's your windpipe and the gullet, or the what we call as the airways. So people find it difficult to breathe. Sometimes some people find it difficult to swallow. So if those symptoms are there, then we need to act on it and perhaps do a surgery and remove the gland. But otherwise, if there is no nodules, we can observe. So these are the common things when the gland is enlarged.
Right. Okay. So we discussed numerous symptoms, like sometimes feeling excessive coldness, sometimes excessive sweating, like we discussed. But sometimes in certain situations we find certain disease conditions which have similar symptoms. So like when a person suffers from those symptoms, if he notices like I'm shivering, but my friend who is adjacent to me, he is not feeling that particular cold. I'm sweating, he is fine with this environment. So sometimes there might be contradictions with these ideas and ideologies. I might having a thyroid disorder. So how can I confirm that?
Okay. So as you said, the symptoms what I mentioned, which I forgot to tell earlier, could be very common symptoms which can be there, especially hypothyroid symptoms can be there with vitamin D. Some of the symptoms can be there with vitamin D deficiency. If the patient is slightly depressed, you might get those symptoms. And on the other hand, hyperthyroid symptoms can be there if somebody is anxious or having a high fever due to a viral infection, those symptoms. So you need to look at, in that context, you have to look at few of the symptoms coming together, not one-off symptom. And then it's a combination of these symptoms that we make a clinical decision. But of course, for a person to know properly, with better to meet your doctor. They will make a clinical suspicion, whether if there is a clinical suspicion with one or two of these symptoms coming together, then they'll do a simple thyroid test, what we call as a TSH. Or we don't have to do profiles, we can do just a TSH test, thyroid stimulating hormone, and then diagnose both hypothyroidism and hyperthyroidism. If hyperthyroidism is suspected, signs, lots of signs are there, you can do what we call as a free T4 test. So with these two simple tests, we can diagnose both these conditions.
And so sometimes in certain health related issues, for an example diabetes, we might think that there is a suspect to have high cholesterol levels also adhering to those factors that we meet. So then we check the other arenas as well. So when thyroid issues are there, what are the other factors that we need to concern?
Okay, that's another area. The metabolic abnormalities or the other tests that can go wrong or change with thyroid problems.
Yes.
As you said, if the gland is underactive, your cholesterol levels can go up due to that.
Yes.
Right? So we don't treat the high cholesterol, we first treat the thyroid condition, and then if it is still high, we treat the high cholesterol.
Right.
On the other hand, there may be certain instances that certain blood tests, unexplained abnormal blood tests might lead you to diagnose thyroid problems, like unusually high cholesterol levels, low sodium levels, then what we call as a muscle enzyme called CPK, creatinine phosphokinase. You know, due to muscle pain, sometimes people do that. So if that is high, then you have to do a thyroid test, and so there are instances where we diagnose thyroid problems when you detect some other abnormal blood test as well.
So, sir, when it comes to that particular investigation, so simply with certain symptoms coming together, we just meet a doctor and he advises us to check the normal TSH. So the reports are little bit abnormal. That means he might be having hyper or hypo, underactive or overactive. So depending on that thing, how can the patient manage himself?
Well, this is not a lifestyle disease like diabetes. So I'm afraid you need medication either way to manage the problem, because you can't manage this only with diet. There are certain instances where if your iodine intake is very low in certain parts of the world, you can sort of reduce the hypothyroidism by increasing the iodine intake. But here we need medication. It's very simple. If your gland is underactive, what you have to take is thyroxine hormone in tablet form. First thing in the morning in an empty stomach. You have to wait for at least half an hour before you have your tea or breakfast. It's very simple. And depending on your body weight, we will decide on the dose, daily dose. If you continuously take it, every 2 to 4 months we need to check your blood levels and then up or down titrate the dose and get the required amount for you. Overactive gland, it's little bit more complicated in managing depending on the underlying cause. What we have said is commonly we have Graves' disease, then we call toxic multinodular goiter or thyroiditis. So depending on the condition, there are ways of managing it. The commonest, what I would say, is the Graves' disease, the enlarged gland producing increase. These things, sometimes people get their eyes also bulging out. If you see the prominent eyes, what we call as Graves' eye disease. So in that condition, we can try with medication first. Carbimazole or propylthiouracil are the common two drugs that we use. If that is not working or not responding, there is radioiodine treatment. That is a radioactive iodine which is given in a capsule form. You swallow that and it gets into it gets concentrated mainly in your thyroid gland. It doesn't affect other glands, and then the function will go down over a period of time. If everything fails, we have the option of surgically taking out the gland, or what you call as a thyroidectomy, and then we can cure the overactive gland. The enlarged gland is different. If the function is not affected, we can't manage that with medication. We need to periodically scan, use an ultrasound scan to look at the gland. If there are nodules and they are looking suspicious of being a malignancy, what we can do, FNAC, fine needle aspiration. What we call a fine needle aspiration. Take a little tissue outside, put it under the microscope and see whether it's malignant or not. If that is the case, you need to take it out. Or if the obstructive symptoms, if you find it difficult to breathe, or you find it difficult to swallow with the gland, even if it is not malignant, there are instances that we recommend surgery.
Right.
So in a nutshell, I mean, that would be the management for all these common thyroid problems.
Right. So simply when people try to find a certain abnormality, they might think that this disease will be getting okay with the lapse of time. So diabetes, like we discussed previously, if we manage the diet and certain other factors that we concentrate, it might get reduced. So people might think, when it comes to thyroid related issues, if they diagnose with high TSH levels, can they think that this will be okay with time?
Yes. Now the commonest cause I told you is chronic autoimmune thyroiditis, or what you call as Hashimoto's thyroiditis, which is commonly associated with what you call as a thyroid peroxidase or thyroid antibodies. These are proteins produced in your own body which acts against your thyroid, more like to say friendly fire, from inside. So these levels tend different reasons in the body, different periods of time, stress issues, all that which we haven't identified properly can wax and wane.
Right.
So there are instances after 4 or 5 years of treatment, sometimes people recover.
Right.
But if your antibody levels are very high, and if there's a family history and you have a sort of a large goiter, sometimes the treatment may be lifelong. But it depends on the individual, and you most of the time you have to play it by the ear. You have to see how it goes and decide what to do. But the overactive gland, we don't go on treating with medication for years together. Maximum it's about 18 months to 2 years.
Right.
You try with medications, because those tablets also can be toxic to your liver and other organs. And we go for second line treatment, radioiodine, or third line would be
surgical
procedure.
Right. Okay, so then once the thyroid gland is removed, that is like removing a part from our body. Like once that gland is removed, the functions, the overall things that it manages with the body becomes zero. So for that we intake thyroxine hormone out from outside. Apart from that, how can we manage it with diet? Can we do like that, or any other certain things that we can do?
No. So once that gland is out, you will have to take a prescribed amount of thyroxine which is needed for your body according to your body weight lifelong. Right? But in a rare instance, a small percentage, as you know, behind the thyroid gland there are 4 tiny glands embedded in the thyroid gland called the parathyroid. Unfortunately, if that gets affected, which happens only very, very rarely nowadays, you might have to take calcium and another 1-alpha, other medication to maintain your calcium levels as well. That is a bit of a troublesome thing, because you need to frequently monitor and all that. But otherwise, it's just one tablet early in the morning, lifelong, you will have to take it. Of course, a lot of people ask this question, whether my voice will be affected, whether will I be able to speak after the operation.
Next question.
So I thought this is going to come anyway. So that happens very, very rarely if the gland is very large and nodular, and your what you call as the nerve supplying the vocal cords, the recurrent laryngeal nerve gets entangled in the gland. Very rarely, I can't say a number, it's so rare, 1 in 1,000 or more than that, it can get affected. Still, you don't lose your voice. Your voice might change a bit. Of course, for a professional singer, it might be a problem, but most people, even with that complication I have seen, they are managing their day-to-day activities, but the quality of their voice might change. But that is extremely rare. We have the technology now, even the surgeons have gadgets during the surgery, way of testing the nerve during the surgery to see that it's intact and it's not cut. So they take all the precautions to avoid that, and we rarely see that. I mean, for the past couple of years, I haven't seen a single patient getting affected with that. Yes.
Right. So that surgical procedure that people might think that the voice gets affected. No, very rarely it can happen, and the novel techniques are there to prevent that thing occurring, and they can even test, as our doctor said. And sir, any other complications that like what you have with your experience with this number of years?
Well, the thyroid cancers are a different variety. So you do FNAC if that is positive. There are different types of cancers which can be there. Then we get the surgeons and the cancer doctors to look after that.
Right.
They remove the gland and they give radioiodine treatment
Right.
to burn whatever the remaining cells in the neck. And these cancers can come up later in life. To prevent that, we have to give higher doses of thyroxine than normal people to keep your TSH or that hormone level suppressed to a very low level, so that the cells won't grow, because TSH is the stimulant, or it promotes growth of the thyroid cells. So, and there is a test called thyroglobulin which needs to be done at least once a year, and with that you could still monitor the cancer patients also. So this is the area that we didn't discuss. Other than that, there is not many, but there are other categories of overactive thyroid which we don't have the time to discuss, like thyroiditis, temporary increase in the thyroid activity with associated pain in the gland. You know, a virus getting into the gland and causing what we call as a thyroiditis. That is not treated with the thyroid hormones. The tablets I was talking about, carbimazole, by simply giving painkillers or a small dose of steroids for a month or two. We can control that condition. That we didn't discuss. So these are the areas, the main types that we have to think of.
And most common thing that people might be afraid of is cancer. So we discussed cancer in this area, in this discipline, with regard to thyroid disorders. As you said, sir, like some are silent. With that fine needle tests, we can investigate and diagnose whether there are malignancy, the cancer simply, or it's silent like benign thing. Can a silent thing get worsened to a cancer in this scenario?
Yes, certainly. Everything starts small, you know. So it could be just embedded inside a small nodule. It may be there for a long period of time, and then it can get worse and it can spread to your neck, your lymph nodes in the neck, even lungs or brain. So it can spread like other cancers, but they are very slow growing. Compared to other cancers, they tend to spread less. But there are certain cancers of thyroid, follicular carcinoma, it gets into your blood and it can go all over your body, even to the bones and everything. So it can spread. That is why you need, even if you notice a nodule, you need to check on that. But they are comparatively slow growing.
Right, with proper management and the proper health advisors, we can prevent everything gets complicated. Right. Okay, so thank you very much, sir, for joining with us to discuss about the thyroid related issues. So we discussed numerous disciplines, the hyperactivity, the underactivity, and certain other inflammatory conditions, and when it comes to cancer, and several disciplines and the novel techniques that used to investigate, and how you should adhere to these conditions and to investigate your proper thyroid levels and get health advisors, not to make them complicated with this small thing. So you can just have particular medications and advices properly on time, that you won't let in trouble with these thyroid related issues. So ladies and gentlemen, this is the iMed program that we discussed. So to do the honors with us, we have with us Dr. Manilka Sumanathilaka. So thank you very much, sir. Consultant endocrinologist and the president of the Diabetes Association of Sri Lanka. We discussed about thyroid related issues, the second most commonest when it comes to, apart from the diabetes conditions. So stay tuned with iMed program. You'll be joining with another episode, numerous disciplines which will enhance your knowledge with regard to ordinary health issues and some specific disease conditions. So thank you very much for joining. Have a pleasant day.